Senator Hickenlooper.
Yes, and thank you, Dr. Califf. It's great to have you back. I appreciate your willingness to come back and not just subject yourself to these questions, but for your service. I was going to try and catch Dr. Paul before he left, Senator Paul, just because I thought it was unique. First time I heard him make a pun like that, where he was talking about the amount of iron in formula and getting to an ironclad solution, but somehow that got passed over. Obviously, the grief that we feel on behalf of those kids it's only compounded this week, just after what's happened in Uvalde. And these are circumstances and situations we wish we could repair. But I do appreciate what you're trying to do, to go back through the entire process and see where the mistakes were made, and then figure out how do you build back a better structure so that we catch the next time we catch it sooner, or perhaps we even avoid it completely. I thought your comments about how to reform an agency made my heart sing, because that's exactly what you've got to do. You've got to look at the culture. You've got to make sure the culture can't, and they are beleaguered now, they've been underfunded, they're short-staffed, they've got to believe in their future, and I think that you understand that and are going to move forward. Now, back to the supply chain management. We continue to react to supply chain interruptions, rather than proactively plan ahead. This is, I think, your inclination to intervene so as to prevent them. Does the FDA have adequate access to the critical supply chain information that you need, not only to address the current formula shortage, but also to help minimize the risk of similar shortages of other life-saving and life-sustaining products?
Short answer is no. If I could take just 30 seconds to just go on about this. I'm a huge advocate of free enterprise and of the individual companies making their decisions that are in their interests. It's worked great for America. But what's happened is each company has its own supply chain, its own optimization, and when someone says, if company X gets in trouble, will we have a supply for that community? On the drug side, we just got authority to require the companies notify us when there's a shortage. We had over 300 last year that we had to help with. And if you talk to hospitals and health systems around the country, they are every day dealing with significant shortages. I would refer you to 60 Minutes last Sunday. Yet for food, we have no authority to compel companies to give us the information, and we even have to pay for it very often to get it, which just seems ridiculous. They have digital information. There's no reason it couldn't be transferred, and there's no reason for the government to intervene except in the case where there's a public health need.
And that's something we might be able to help you with, I suspect. How can we, at that, and this is just a continuation of that thought, at the federal level, support platforms like 21 Forward, analyze supply chain data?
I really appreciate that question. I have to be careful here because I came from the best computing environment in the world back into the federal government, which is, as I keep saying, full of, I just want to say it over and over, very hardworking people, not people who are sitting at home, lounging around. These are hardworking people, but they're greatly impaired by legacy systems. Anyone that's been involved in the technology industry knows that you have to update your systems. Companies have capital budgets. As you know, you've run companies, and you put it into capital equipment, and that's an expense that you take. We are woefully short. We're doing the best we can with gum and chicken wire to put things together. But ultimately, there's going to be a reckoning on this in the federal government. I would also point to CMS as a group that needs help, with whom we're doing a lot of work. But on the food side, we just need fundamental funding and technology to enable us to do our work. Imagine an FDA inspector armed with the kind of equipment that I saw at Google, how much more efficient they would be in getting their job done because they're not hand-entering data into an old computer.
Exactly. Well, at some point, we did an infrastructure bill this year in the Senate that was bipartisan, and I think maybe one of the next big things we should look at would be a technological infrastructure for government, because we are, in almost every agency, decades behind, not just a few years out of date. I've got maybe I'll just lay this question out, and you don't have to answer because I think I'm out of time. Based on the information you have, what do you see as potentially, maybe I'll let you have 15 seconds to answer, with the chair's permission. What's the next supply chain crisis for critical foods or drugs under the purview of FDA? What do you see as looming problems?
Well, I mean, we already have one, which is contrast media, which is the opposite of the onshoring problem that we had here. We had a major manufacturer, GE, which had its only plant, I don't know all the details, making contrast media in Shanghai. And when the COVID problem hit there, they shut down, and all of a sudden, we've had a number of medical illnesses in Congress lately. Someone with a stroke or heart attack wouldn't be able to get an angiogram. I mean, it's just unbelievable. But it's happening, and I could give you a list of dozens where we're precariously. This is just in time, which is very efficient when things work well with very little inventory. That's the most efficient way to run a company. But then when something goes wrong, if it's not a critical supply you need for health, okay, so you don't have tennis shoes for a couple of weeks. No one, you make up for it. But when it's a critical thing like
I'm going
infant formula.
to interrupt here. We
Yeah,
do need to
thank
move
you.
on. Thank you.